Scleroderma warriors near and far, and welcome to the Scleroderma Foundation of California's Sclero Sun Podcast. My name is Tina Berger, and I'm the Patient Services Director, and always with me is Alejandra, Scleroderma warrior, and our Foundation's Administrative Coordinator. Today, the Foundation sits down with Alicia Barron, Executive Director with the Infusion Access Foundation, a nonprofit comprised of a community of patients and advocates united to protect access to infused and injection therapies. Thank you for joining us today, Alicia. We're really looking forward to learning more about the Infusion Access Foundation and the role your organization plays in helping patients navigating treatment that requires injections and infusions. I was so glad that I had this opportunity coming across this, and maybe I should give a little background that somehow I think Hawaii Rheumatology Society introduced one of your co-workers that works with some of the access in Hawaii to our Hawaii support group leader, Lynn. And I started reading about you and thought, gosh, what great information. And that's when I asked for the meeting with you and learned so much about your program and your organization. And I really thought that it was important for our families to understand what you do, because so many people living with scleroderma are on injection therapy and infusion therapies. And one of the biggest things, Alicia, is getting coverage, getting it paid for, getting it accepted. And this is becoming a growing problem. And in particular, what we're seeing is when something's newly approved by the FDA and it's out on the market, there's almost no, the denial process is huge. And here we are with some of these life-saving treatments out on the market, and we can't even get it covered. So having an organization like you that's dedicated, it makes us proud to learn more about you and partner and make sure that our families know about your organization and the resources that you have. So we really appreciate that. And I'd like to start with you sharing a little bit about yourself and how you got involved with the Infusion Access Foundation.
Sure. Well, first, thank you so much for allowing me to come join you on this show. I'm really excited about this. And yeah, it was a delight to meet you and get a chance to learn more about your organization and what you do. And to have Lynn join my colleague Kendall, she's our advocacy director. She did a really fantastic presentation to the Hawaii Rheumatology Society's patient education about advocacy and getting involved in advocacy, and then had a chance to talk to Lynn. So I'm excited. We have a video coming out with her for all about her sharing her story. So I will definitely make sure I share it with you so you can share it with your community here as soon as it's done. But awesome. Really appreciate it. She was fantastic. So very excited.
Thank you.
But yeah, so Infusion Access Foundation, I started with them just a few years ago. At this point, it feels forever, but it hasn't been. I have worked in the chronic and rare disease space, mainly chronic illness space, for my entire career, and that's 25 years now, which feels really hard to believe. But I got involved because my dad had multiple sclerosis. And so, unfortunately, being a child of somebody living with a chronic illness, not a lot you can do, especially when you're a teenager. And, so that really kind of spurred me on the path of, finding ways that I could contribute back to our community and people like my dad and my family to be able to try to kind of see if there's something I could do. And so that took me down the path of becoming a social worker and focusing specifically in advocacy, because that was the one thing that I really found that I was passionate about is, I learned to become an advocate for people with these different conditions and started doing legislative visits and advocacy. And it was something that really made me feel like I was contributing, and it made me feel like I had taken back some of the power that had created a lot of powerlessness in our family. And so, that's how I got involved. And I got started working with nonprofit organizations, focusing around these different chronic and rare diseases, and doing a lot of patient services and coordination, case management, things like that, because I am a social worker by background. And then because of that, I had found the Infusion Access Foundation, and when they had a role open, I thought, this is a great opportunity for me to take kind of a young organization and take all of this experience I've had with all these different types of chronic illnesses and combine that into the work that we're doing at the Infusion Access Foundation. So that's how I got started in this world, and it's been really fun to be able to learn more about other types of diseases and to see how much similarity there is, unfortunately, among all these different diseases, and to be able to kind of figure out how do I take all of these different wonderful people that I'm meeting in all these organizations and kind of say, hey, this is something we're all facing. Let's all work on it together. And how can I help create that kind of unified voice to really highlight to our insurance companies, to our legislators, that this is a problem, not just for the Scleroderma Foundation or the folks living with scleroderma, but also all these other disease states over there. If you start counting the number of people who live with chronic and rare diseases, it's a huge population. And so all those collective voices, I think, that is really what's going to drive change. So that's what I love. So that's how I got started.
Yeah, I get a little tickle in my chest listening to you talk about it. I love your background, and I love that it led you to this. And I always say it's funny, but it's not funny. Here, these are things that happened in your personal life that led you and drove you to getting more involved because of the way it impacted your family. And you learned so many things. And then you saw this area of opportunity and what you can relate to. And then then seeing it in a bigger picture with rare disease, for instance. And it's something that we've learned too with a lot of these overlaps. And I think you and I, when we first met, talked about that. So while you can have this one disease, there's these overlaps and these other things. And as a result of a lot of these conditions, you're in need of certain targeted therapies. And in some cases, drugs that are on the market for something else. Yet we know that it's life-saving for something that they're treating. So I think it's amazing. And how it's blooming into what it is, and how that you've been able to even expand your thought process and what you see being a part of the Infusion Access Foundation. So thanks for sharing that. So I went through your website with a fine-tooth comb, and I love doing that because that's what allows me to see the benefits of having people come to your website and learn. And I think that it's very self-sufficient, and patients and families can navigate that. And you've got these great little areas. And so as I was looking through it, you know what? I'm jumping a little ahead. Can you give me a little bit of a background on the Infusion Access Foundation's mission and their history of the organization?
Sure. Yeah, I'll start. Our mission is pretty simple. It's really that we are focused on ensuring that people living with chronic and rare diseases have access to infused and injected therapies. Like you said, unfortunately, there are barriers that end up getting put in the way, and before people can really access those. And so it's a pretty simple mission that unfortunately has a lot of complicated pieces attached to it. And the history of the organization, like I said, we're kind of younger organization, is that we actually started as a combination with another organization called the National Infusion Center Association. So NICA is their acronym, and they tend to go by NICA. Right now, NICA is a trade nonprofit organization. So it's a 501c6 organization that works to ensure that those ambulatory infusion centers, so those community-based infusion centers that you see either sometimes as part of a pharmacy or an actual standalone building or office where people can go and get their infusions that are outside of a hospital system. Those are specialty businesses. And so there's a certain amount of, business practices that they need in order to stay in business. So things like drug pricing and compensation and things like that are part of the healthcare system. So they really represent those. When they first started out, though, they also had patient advocacy as part of what they were doing. As you can imagine, you can't have an infusion center that's successful without having patients that actually walk in the door and use your services. And so they were doing both. And as they grew up, and they started out as a 501c3 organization, so kind of similar to what our foundations are. And so, but as they sort of grew up, they realized that they needed to be able to do more lobbying. And as 501c3 organizations, were limited in how we can lobby and really have to do much more on the grassroots advocacy side of the world. So they became a 501c6 organization. And then they took out the patient advocacy piece and they stood up the Infusion Access Foundation on top of that 501c3 number. Hopefully this isn't too complicated for folks. It's all a bunch of tax code, basically. But we became a patient organization that really focuses, again, on ensuring that patients can get the medications. But we work really closely still with the National Infusion Center Association because those are where those patients are going. It's great for us to be able to talk to the infusion centers and to be able to help the patients that are walking in the door, or to provide education for those folks that they see that, walk in the door and really kind of don't understand what's happening or don't really know what they're getting. And so we can work with them to really make sure that we're kind of filling in those gaps that may happen for those patients. So we work still really, really closely with them, but we also work really independently on patient access issues, education, and and advocacy efforts to really ensure that we're moving forward over there. So that's kind of our history. That happened about 6 years ago. We're about to hit our 6th birthday. Actually, I think we may be on our sixth birthday here very soon. And so, we're still figuring out kind of where we fit in the world and really expanding our mission as we continue to grow. But part of what we do is really like you and I did. We have outreach to a lot of the organizations that work in the disease specific spaces or in the rare disease community because we have such a, like you said, a pretty narrow lane that we live in. And we want to be able to help contribute to the mission of other organizations in the way that we can because we are in our lane. So we don't want to be in your lane, but we want to make sure that our lanes intersect every once in a while so that we can work together and get everybody down the highway to continue with that metaphor. So that's kind of to give you a little bit of a history of the organization.
I actually love the way you said that. We don't want to be in your lane, but yeah, we want to be next to your lane. I love it. And that's the truth. That's why I love these opportunities to get the word out because we all have our niches and our niches are strong and we know where they are. But we want to make sure that our families, regardless of the organization, have the opportunities to know about different organizations that can be more specific in one area. And this is it right here. And so while we have our advocacy and we have specific things that we focus on, and while some of them intertwine a little bit, yours is very, very specific and very centered in one area. And it is something that a lot of our families are dealing with. I was talking with a wonderful woman that I met in Chicago that is got scleroderma and has a background working for Medicare for years. And she is seeing how much patients are getting denials for a lot of these drugs that are on the market. And I mentioned to you before we went live how that there are some of these life-saving drugs that have just recently got approved and they're being denied. And how do we stop that from happening? How do we become a part of the process for that not to happen because patients are missing out on some of these life-saving drugs as a result of this. And our system is just so screwed up. There's not a better way to say it. It really is true. And if
it is the right way, yes.
Your business you guys wouldn't be around.
No. And frankly, I wish we didn't need to be. I joke on a regular basis that I would love to work myself out of a job because you're right. Our healthcare system should not be this complicated. It should not be this unfavorable to people who actually need the services that they provide. And so I get on soapboxes pretty regularly. And, this woman you're talking about that's, works with Medicare, that's a really important thing to understand is that Medicare is how insurance companies build their programs. So the things that change in Medicare, typically you're going to then see those changes trickle into the healthcare plans that your health and your employers are providing to you. So when Medicare changes, you can bet that the health insurance that you're getting in those plans called ERISA plans or individual plans are probably going to change too. So there's a ripple effect for this.
Wow. Sure. I never knew that. I never knew that. And I did see when I was going through your website, and I'm getting a little ahead of myself, that you have little areas that even talk about insurance access and picking your plans and understanding things. And so you guys are even going above and beyond in another area that was on your website, and I appreciate that. So I didn't know that. So I'm glad that you said it. So let's see. One of the things I liked was finding an infusion center. And the reason that I appreciated that was, we have some people who go into these private practices that don't have, the labs and the x-rays and, infusion centers. And so you have to find them. And my question kind of was like, are all infusion centers the same? Are there some that we would want to avoid? Do you guys try to have like I don't even know the right word, an integral
like a rating system?
Yeah, there we go. To that. So there must have been some time put into being able to locate an infusion center and why that was important. So can you elaborate on that?
Sure. Yeah. I mean, I think what people don't recognize is that, and this happened to me. I was anemic. I needed an iron infusion, right? Or actually two. And, my doctor said, you need an iron infusion. And they handed me a slip and said, okay, go talk to our infusion center, which was part of the hospital system. I didn't think twice about it. I just went to that infusion center. Well, when I walked in the door, it was an oncology infusion center. And so it was me, a perfectly healthy, other than anemic person, dressed in my business clothes. I was taking public transportation at the time. I lived in Boston. I was around people all over the place. And I walked into a center with nothing but people that were getting chemotherapy and who should probably not be around somebody who's bringing whatever germs in the door. So I was really uncomfortable. And that was well before I worked for the Infusion Access Foundation. I didn't realize that I didn't have to just go where they told me to go. I didn't have to stay within the hospital system. And in fact, it actually probably would have cost me less money to go outside of the hospital system. And so it's one of the things we do as Infusion Access Foundation is say you have choice. You don't have to just go there because frankly, it might be that there's something that's more convenient for you. So that's where if you are prescribed an infusion for whatever reason, a vitamin infusion, iron, or one of these medications that you need for your scleroderma specifically, even if it's off label, you don't have to go to the one they tell you to. You can go and find one, and you can use our infusion locating service to be able to help find one that might be more convenient to you. At the time, fortunately, that one was close to my office, and so I could just run over there, get my infusion, and come back to work, and that was easy for me. Had it not been right close to my office, it would have been really inconvenient for me. And so maybe finding one that was closer to my office, or finding one that was closer to my home, or finding one that had hours that were not business hours would have been really beneficial. So that's what you can find on our infusion center locator. The great thing about that is it is maintained by the National Infusion Center Association. So fortunately, they are the ones that take care of that. It's updated. And if you have an infusion center, you can even go in there and list your infusion center. The nice thing about that is it also gives you lots of information. So business hours, the types of medications they provide. Sometimes they'll even have pictures of, their infusion center, so you know what to look for there. And also a lot of them are kind of like spa-like environments. Frankly, some of them are really like very fancy. I kind of want to go get an infusion sometimes because they have, the big lazy boy, chairs, and they'll bring you snacks, and they have blankets. And so they give you all this information on that site too. You can kind of find out what mainly is better. We don't have a ranking system for them. We do on a regular though basis. I talk to the infusion center operators that are part of the National Infusion Center's advisory committee and their members to be able to help them understand what patients need though. So for instance, the National Infusion Centers Association's conference is coming up here in July, and we always have a patient panel on there. And our topic is always with patients sitting there telling infusion operators and infusion nurses, this is what we want, this is what we need, this is what we like. So that they can really build their business around that patient voice. And many of them take that very, 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 very seriously. And so we have some really fantastic infusion centers we work with that try very, very hard to make sure that the patients are getting the medications they need. They're helping them fight for denials. And also they're working, with them if something comes up, and they're able to really help kind of be part of that healthcare ecosystem that those patients need. It's just another person that's helping you as you go along your way. And they work very closely with your doctor's office. So that, again, they're not disease specific either. They provide infusions for, any type of illness that needs an infusion, but they'll still work really closely with your doctor's office and communicate with them to make sure that they're recognizing what's happening. So that's kind of how we work together, but no ranking system, unfortunately. But I guarantee you can find out about it anyway. You go join a support group and you're going to hear whether people had a good experience or not. I know that happens all the time. Or frankly, I don't recommend Reddit, but that's also a place where you're always going to get opinions, whether you want them or not. So.
It's funny. I had no idea that this one question would have so much to it. And I think it's really, but it's good. And the reason I say that is it's not just saying, hey, where is the closest infusion center? It's like when people are looking for a rheumatologist, there's a difference between a rheumatologist and a rheumatologist that specializes in scleroderma. We had somebody working with us once that said, I put this whole list together of all these doctors. And I went, oh, no. Because for us, we want to make sure that these are doctors that specialize in scleroderma. And we take that very seriously. So that's what you guys are doing, because what it sounds like is not all infusion centers do all the infusions also. I didn't know that until you said that. And the way that they work, with your doctor and the other things that come with it, and including insurance and coverage and things like that. So you elaborated on a lot of things that were very important. And again, it goes to show just the depth and the detail that was important for you all to put into what people are coming to see on your website. So, I'm glad.
I would be remiss to say I missed also that you can also many folks can get home infusion. So for those folks where, going to an infusion center really doesn't work, or their children, or, they're more comfortable at home, Or if sometimes you're in a rural community where there isn't access to an infusion center and you're far, far away from your hospital, many, many companies will also offer home infusion, which is where that nurse comes to you and comes to your home and does it. And that isn't necessarily, sometimes those are folks that also have infusion centers, so you can find them on that locator. But if you go to the National Home Infusion Association, so NHIA, they have a home infusion locator. And so when you're sitting and talking to your doctor and you're kind of saying what works for me, that's part of the kind of calculation you can do with your doctor is to say, is this the best medication for me? Is this the right delivery mechanism for me? Because maybe an infusion doesn't work for you and an injection is better, or a pill is better for you. It's something you have to figure out how it fits with your lifestyle, but also where fits best with your lifestyle. I know there's some folks that they really want to go to the infusion center that's part of their hospital because they trust that. Totally understand that. Great. That should be your decision. But it also should be your decision whether you want to go someplace else, like in a community-based infusion center that's easier for you to get to, or whether home is the best option for you, as long as, whatever is safest and what's the best choice for you. That should be really the calculation you and your doctor are doing. Unfortunately, again, sometimes insurance gets involved there. But, that is the place where you should definitely start to say, this is what's important to me. Because for some folks, home infusion is the better option. And so there are these 3 different options, and, that should be part of your shared decision-making with your provider. And I'm 100% with you. One doctor isn't the same as another doctor, and finding a person that is really versed in your disease is really important, especially when you have a more rare disease, because there's just less people that know a lot about it. So, even if it's working with a specialist once a year to make sure your treatment plan is in place, and working with a doctor that is a rheumatologist that's a little bit, more of a community-based person, but doesn't have that specialty, having somebody who is the expert to be able to kind of go back to say, is this still the right path for me? I think is so, so, so important.
Yeah. And, it's funny. Further into my questions was your frequently asked questions, and this was part of that. But you've sort of talked about that a little bit.
Jumping the gun, sorry.
No, I like it. I like it because it all comes together, and you never know how it's going to come together. But it's wonderful information. And what you sparked in me is somebody that I know on her scleroderma journey has a 3 to 4 hour drive to her specialist and hospital, and was recently hospitalized and needs to go on some long-term infusions to care for her. And to think of the daunting task of having to have people help her get back to, some of these infusions are going to be daily, and there's a couple of them that are going to be monthly, and things will straighten out after a while. It's very intense at the beginning, but just the thought process and what she said to me is they're discharging me, and we're fingers crossed that they're going to allow home health to give me my infusions from home, because I did well in the hospital, and I feel comfortable doing that. And I want to give my family a break from having to keep taking me to these appointments. But what you just sparked in me is that if there's a possibility where there's a denial, maybe she should be looking into the resources that you guys provide to see if that can help her, because she is literally anxious over this because it's just so much. And when somebody has a chronic illness, I don't think people realize the toll it takes on everybody, the family as well. So I really appreciate you elaborating on that.
Yeah.
Like I said, these keep getting my little tickles in my chest while you're talking. So
well, and I hope this is helpful, because she shouldn't have to be worrying about that and worrying about, how it's impacting your family, when I'm sure they are very, very willing to go to and do whatever she needs. But there shouldn't be that layer of anxiety. People should understand and recognize, and our healthcare system should be better about supporting and saying, hey, we got you. We've already set up home healthcare to help you, and home infusion to help you, and all these things or medical transport, so she doesn't have to rely on a family member to take her back and forth. This is the way our healthcare system should work, is to be able to support the people that really need the services that it provides. And so it's always frustrating, hearing that that's the case, so
And to top it off, just because the hospital discharged you with this information, they didn't do the process of making sure it was covered. They just sent you the information. And that's what she said. She said, how much do you want to bet, Tina, that something's going to happen before I get that infusion? And they're going to deny it. And it's because the hospital staff doesn't have the means, I think, to take it that next step.
All the plans are so complicated. I don't think they can know what's going to be covered, and even even as something as silly, and I say silly as, a bit of tongue in cheek, but, I had to go to the emergency room to get stitches, and this was years ago, but, I got a bill for the emergency room, going to the, emergency room, like, okay, fair. And then I got another bill for the doctor. And I was like, but
Yes.
I
Yes.
can't go to the emergency room like without a doctor. So like, and like, it was so odd to me. Like, why is the doctor being billed separately? And that doctor could have been out of network for me, and then I would have not been able to, that wouldn't have been covered. And I'm like, how, but I didn't. How would I know that? I had to just get stitches. So I'm bleeding. I'm not going to worry about asking which, are you on my plan? Are you in my network?
Yep.
Nor did I even think that it would be two separate things. And so, are the healthcare plans are so gosh darn complicated that it's even difficult for, our providers to be able to figure out whether this is actually something that can be covered. They basically say, we think this is what's best, and then they send it out into the ether and sort of hope for the best. And then we all keep our fingers crossed to see whether it's covered or not. So
Yeah,
yeah.
it's funny. I was just telling Alejandra, I had a small surgery to take some pins out of my ankle after an accident. And when I got to the center, and they said, you're going to go to the finance office first. And I said, for what? And they said, oh, we just have to start there to get you processed. And then they said, okay, you have an out-of-pocket payment today. And I said, well, I always have a copay. What is it? 1,000 $240, no, $2,140. And I said, wait. Nobody told me about that. I wasn't expecting that. And she said, well, somebody should have called you. And I wasn't prepared for it. But if I didn't make the payment, I wasn't going to get the surgery.
Right.
And here's one of those exact perfect examples of the different things that people don't realize until they become a patient, and some of the things, the categories that we can fall into. So it speaks to what you are talking about right now. So it's great to know that that's out there. So in one of the other things that I saw, which we'll just do a small thing about, is I just wanted to add that I thought it was really cool to see that you guys even have an opportunity to see what clinical trials are being done in your disease. And it can be in a 10-mile radius, and it can be all over, so it can be out of state. You just put in the name of your disease, and then you go in there. And I know that it's somehow probably connected to clinicaltrials.gov, I think, because a lot of the studies that are in there. But it was nice to know that opportunity affords itself on your website, which is not something I expected to see, to be honest with you, but it was there. So I just wanted to say that it was cool to see that. And I thought, okay, let's see if it's going to have scleroderma in there, and it did. So I just wanted to mention that. But also, then you have this really great area called your frequently asked questions. And while there were many, there were some that really spoke to me for our patients. And one of them was, what types of diseases do infusions and injections treat? Another one was, how should I prepare for my treatment? Another one was, what if I need to miss work because of my infusion? How do I travel as an infusion patient? And you kind of spoke on it with this locator, because I believe that it coincides with trying to help people. And that's a big one. People sometimes won't travel just because there's this fear of, but what do I postpone a treatment? Do I postpone going out of town, enjoying, time? Maybe there was an unexpected, family emergency and that you need to travel, but you need to get your infusion. So I think that was great to know that this locator will also help you outside of your city and state, so to speak. So
Yeah. We've had some people contact us that were looking to, they said there was a snowbird, right? So somebody who lives in the north and goes to the south during the winter, and we're able to use our locator to be able to find, an infusion center and be able to have them coordinate with each other, so that as they were going back and forth, they were able to, get services with both. And, and we had somebody who was like, oh, I'm going to go spend a month in California, so go in your direction. And, so we were able to help her find an infusion center that was able to, again, work with her provider and be able to get her infusions while she was going to be gone for the month. And so definitely ways to be able to, to branch out. Infusion shouldn't be the thing that keeps you from doing other things. Hopefully, it's what's making you well enough to be able to go do those things. And so, this is a potential opportunity for you to maybe branch out. The one I haven't quite figured out is international travel. I'm still working on that one because we don't have any international sites on there. But I found some resources here and there that do help you with that. And but yeah, that's one that I haven't quite figured out. So you might have to navigate that one a little bit differently. But I'm happy to help you with it.
You're thinking about, which I appreciate.
Yeah.
That's even coming to your mind. So
Mhm.
yeah, and when you think about starting an infusion, especially whether you're newly diagnosed to something or your disease activity has changed and this is now your new course, it's daunting to think
Yeah.
sometimes about what you're going to go through to get an infusion. And so it's like when we talk to people when they're newly diagnosed or they just learn about our organization, I think I told you there's a sigh of relief that I hear in their voice. And I love that moment of knowing that we've been able to meet their needs. And that's what you're doing. You're taking a little bit of that anxiety out of the equation because you've got this very specific, detailed, helpful organization and resources on your page. One of them, and it kind of goes back to what we were already talking about, was also under the frequently asked questions. How do I pay for my infusion or injection treatment? What if I can't afford this medicine? Mm-hmm. So you even talk about patient assistant programs. Can you talk a little bit about that as well?
Yeah, I'm always surprised at how many people don't realize that there is patient assistance out there, and so it's that this is our way of kind of reminding people that this is happening. And so, primary thing is that if you are prescribed a specific medication, that manufacturer that makes that medication will have some sort of patient assistance. I think the caveat you need to recognize there is if you are on Medicare or Medicaid, you might not be able to access that because there are government regulations that say that because it's a government specific plan, you can't get financial assistance from the manufacturer. They consider that a kickback. And so that's the caveat there. But if you are on either you're uninsured or you are on an insurance plan that's through your employer or through the marketplace, there's patient assistance that is offered usually through the manufacturer. And what's great about that is also a lot of them also have people that are kind of social workers and people that can help navigate and help you figure out if there are other resources available. There's also other nonprofit organizations, so people like the Assistance Fund, the Patient Assistance Foundation, that offer Accessia Health is another one that offer funds for specific disease states. And so what they do is they receive funding and they provide financial assistance out to folks. Sometimes it isn't just for medication. Sometimes it's for travel to get to an infusion or other types of aspects of living with a chronic illness. And so those are really fantastic things available to you. And those are typically open to people who are also on government plans. And so sometimes that might be your first port of call is to go there. Finally, if you are in Medicaid or Medicare, there are some assistance programs through the actual Social Security Administration or through the government. And so there's an extra care program. So if you're on Medicare, you can get extra care and it helps pay for some of those medications. And just in the last year, they implemented a program called Medicare Smoothing is the name of it. Not a very great name, but Medicare Smoothing, which basically if you enroll in that, it keeps your medication costs as minimal as possible, but you have to enroll in the program. And so certainly if you are on Medicare, contact the Medicare, your Medicare folks, or oftentimes your pharmacy also will have information about Medicare smoothing and see if it's possible for you to enroll. It might be out not this year, but it might be once you come into Medicare open enrollment and you start your new plan year that you'd be able to enroll in that program. So there are options available to you to try to help make this more affordable. So if you are struggling in any way, start asking for help. Go to our website. You can find information there. I'm sure your website has lots of information. Talk to your doctor's offices. Call the manufacturers of your medication. There are options available to you. Oh, I love it. We get a puppy. No, I love it. Mine jumped in the window behind me, so you're going to get a little piece of mine as well.
To get on my desk. Yeah. Thanks, Papa.
But yeah, okay. No, and the other thing I would say, just the social worker in me is also typically if you dial 311, that will get you into the United Way for all of your area. So anywhere across the country, if you dial 311, if you contact the United Way and say, I'm struggling to pay my bills, in any way. Like if you need to free up some medication or some money to be able to pay for your medication, you might be able to qualify for something like rent assistance or bill is paying assistance for your light bill or your electricity bill or anything like that to be able to free up some money for you to be able to put towards your healthcare. And so it might be that your financial assistance isn't going to come because of your disease. It might be because it comes because you need help in other ways. So explore all of your options to see what's available to you to be able to try to figure out how you might be able to, work that into your budget.
That's wonderful. Thank you.
Sure.
Okay, so we kind of talked about this where if you lived in a rural area, and one of the frequently asked questions was, what if I live in a rural or remote area and need infusion therapy? And while we talked about that locator being able to help with that, what it also talked about, which I really appreciated, was that there is I think that some of it was through the National Infusion Center Association, but it's what I didn't know is that you guys had some information about the Air Care Alliance volunteers free flights. It says when certain people need to access medical services, there's no limit on the number of flights that you can take to get your treatment. And they do have a couple requirements. I never heard of this before. And if I wasn't on your website, I would never know about it. And let me tell you, this is an issue. People go through this. Some people give up on even doing something as a result of that. And I didn't meet her. We talked over the phone and we did a Zoom visit, but she's got to travel, like a day to get to the closest, even hospital setting for medical care. And so, and she has a small child at home, and they are on a very fixed income, especially once she got sick and she was not able to work anymore. Mm-hmm. And so knowing that there is something out there, I just really appreciated it, and I wanted to say a little bit more. It says, you need to live more than 2 hours by car away from your treatment site, but no more than 1,000 miles away. You must be physically able to get in and out of a small aircraft with little assistance. These flights do not provide medical support during the flight. You'll need to provide some documentation from your provider that you have a medical condition and need the service. If it's your first time receiving treatment and you have a long distance drive, you may want to plan to stay overnight in a hotel until you know that you how your treatment will affect you. But even that, so not only is it making sure that you know about this wonderful alliance, but it's even giving you some practical thoughts that you might not think about because you're overwhelmed with your condition. You're overwhelmed in trying to access treatment. And so here's some things that they're even preparing you for. And it even says some private foundations may help with the cost of transportation for your treatment. The best way to find them is to do the search under patient financial. They just give more information about it. So I really appreciated that there is this alliance. And I want to make sure other people know about this because that's a big problem. So would have never known without looking at your website for that. So
there are all sorts of interesting, resources available to folks, but you do have to dig for it sometimes. Or, there are some places like patient assistance funds or TAF or, some of these other organizations that do provide financial assistance that might be able to provide that transportation assistance or direct you to where there is. And so, it's daunting. I know it can be daunting, and especially when you live someplace really rural and your healthcare is far away. One of my good friends, she lives with Crohn's disease and rheumatoid arthritis, and she has to drive 3 hours to her doctor because she in her case she's chose to live someplace a little more rural, but she's able to recognize that she's able to do that. But for some folks, they just aren't. If you live in Alaska or Hawaii, you're having to travel a long way to get your care, and there's potentially a flight involved, and so it is difficult. So if we can provide those resources, we definitely want to be able to be helpful to folks because they're out there. It's just sometimes they're a little difficult to find.
Yeah. Well, you guys found it. You put it on your website. So under your frequently asked questions. So I really appreciated that. And just to quickly go over a few other things. Can I receive my treatment if I'm sick? Should I contact my infusion clinic if I have surgery scheduled? Can I receive treatment if I'm pregnant or trying to become pregnant? How should I prepare for my treatment? I really like that one. I'm having side effects for my treatment. Help. What should I wear on treatment day? People don't think about being comfortable, You're just you're just helping this person really be prepared for this new part of their journey, with an infusion. What should I pack for treatment day? Can I bring my service dog to treatment? Do I need to stop my blood thinners before my infusion? And while you would think that your doctor's office are going to answer some of these things, they don't. They don't always answer those questions or get to you in time.
Well, and it's quirky stuff like, the one of like, what should I wear? I think people don't realize that, your medication when you're getting infused, the medication is going to be at room temperature. But if you think about it, room temperature is not your body temperature. And so when it comes in, it's going to make you feel cold, even if it's a hot day outside. So, being able to dress in layers, being able to take things on and off, and also it has some accessibility so that people can actually get to your, where they need to do your infusion is definitely kind of important. And, but it's not something I think people think about. The other thing is I know I am terrible about drinking enough water. I'm every year, this is my New Year's resolution, and every year I fail. But, if I need to go in to get a blood draw or I need to get an infusion, you bet your butt I'm going to be drinking extra water. That's safe. Obviously, for some folks with kidney issues, they have to be careful, but enough water so that my veins are more accessible, because it is going to make your veins more accessible. It's going to make that stick easier. And, that's the faster you get it in, the better, right? You only want one stick, and a lot of our nurses are amazing, but let's make it even easier for them to get it right away.
And interesting that you said that, because while I was talking to that same person that's going to start this infusion therapy, that's what one of the problems was with her veins. And one of your frequently asked questions is, will continued IV treatment damage my veins? Do I need to rotate my IV sites? And I guarantee that some of the things that you just mentioned are expressed in this frequently asked question.
Well, and there are vein finding tools available too. This is something I've learned more about, obviously, with this current job. But for some of our for some infusion centers, but also in the hospital systems, there are things like vein finding tools. They have almost like cameras that will show where your veins are, or there's ultrasound guided needle as insertion as well that can be happen. So if you have really tough veins, it might behoove you to go and call and say, hey, my veins are tiny, my veins roll. I've had a lot of infusions, I've had a lot of sticks. And so, they're difficult. And so you can ask for those tools. You don't have to wait. You can just call up and proactively say, what vein finding tools do you have? What kind of venous access training do your nurses receive? Because there is special training that infusion nurses or nurses can receive to be able to better access your veins. So, and it's not something that automatically happens for the nurses. And so if you have tough, quote unquote, veins, then you might want to be able to make sure you're doing what you can to keep yourself ready, but also, ask if there's tools available that they could use if they're having any problems with you, or that they could just use right away if it's tough, and you have the right to ask for that. You as a patient have lots and lots of rights. And I think sometimes I know you get in there and you go, I just need to get my treatment, so I'm going to sit here and kind of take it. But you can ask these questions. You have the right to say, hang on, you're not getting it. Who else do you have that maybe has better, has more skills, or somebody else that can try, and so, especially folks that if there's even a pediatric department as part of it, sometimes the pediatric nurses are a little bit better about finding teeny tiny little veins, and so you have the right to ask for what you need and what will work best for you. And if somebody is having problems, you say, who else is there? Let's have somebody else try it.
And I love that you elaborated on that, because as people are listening to this, it's going to resonate, because scleroderma patients are hard sticks. And a lot of times their veins blow, or they're very small, or they have a lack of problems with circulation, a lot of Raynaud's. And can you imagine that they're going in for an infusion? And so you're helping them be empowered to know how to ask questions and speak up for themselves, also by just saying what you said in today's podcast. So I appreciate that.
Good.
We're going to switch gears now. We're going to talk about advocacy. And this is what I love. It's not just in, all the things that we talked about, but you've got advocacy on the other side. And while you and I talked this and got to know each other, I told you that we're really trying to get much more involved. We want the patient's voice, but we also have our niche, as we talked about, the areas that we focus on. And while some of it is some of the things that you're at, it's not at the level that you guys are. And this is important. And this is something that needs to be talked about. And our patients, This is big for them. So understanding that we all can work together in the best interest of the families that we serve. And if there's something that we do really good, okay, it's us. But if we know that they do, I want people to know that. I always say that we should always be branching out and making sure that we work with
Mhm.
organizations that are going to benefit our families. That's all
Yeah,
it is to us. We want people to know that. So,
absolutely.
can you talk about what does the Infusion Access Foundation do to support advocacy, and how do you advocate for patients?
Absolutely. Yes, advocacy is one of the cornerstones of what we do. As you can imagine, not being disease specific, this is part of our lane, right? Is that we want to be really, really good and work with patients and groups like yours to really make sure that we're building that capacity for advocacy within your organization. I told you guys that I got involved because I wanted to do something, and this gave me something to do. I tell you what, there's nothing that's more beautiful than seeing people at the end of doing a Hill visit, or going to DC and visiting their legislators. Everybody is so pumped because they feel so empowered. And so it is just a really beautiful thing to be able to kind of layer in to what you're doing as a patient, because you're not just helping yourself, you're advancing things for other people. You're advancing research funding to go towards your disease. You're advancing stories that will help people better recognize how we can change the healthcare system. And nothing will change without patient stories. It does not matter how many times I go in front of them and give them statistics or talk about it in a conceptual way. It's when somebody like Alejandra sits down and says, this is how this has impacted me. This is how the healthcare system has impacted me, or not having access to my medications and having to go through something like step therapy has affected me. And so that's really why we're so focused on advocacy, because again, we see this as the overarching theme of all of the different disease groups that we work with, all the diseases that have infusion or injected therapies, is there's these barriers to care. And they really have to do with what's called utilization management. That's where a lot of it fits in. And what that means is that these are the things that your insurance company puts kind of in the way between you and your treatment to manage their costs, is kind of typically how it goes. So something like step therapy is something like that. So step therapy, for those folks, I know you've been through it, but the official sort of definition is that step therapy is where you're asked to try a different medication than the other one that your doctor recommended, and you have to sort of step through it. So you try and fail it. And well, I should say you try and it fails you typically, and then you are able to move on to a different product. And sometimes there's multiple steps before you can even get to the one that your doctor prescribes. Alejandra's nodding, nodding, nodding. Yes. We've all been through this. I just went through this for my migraine medicines. Like, it happens all the time. And sometimes it's fine. Sometimes it's trying a different, antibiotic instead of the other one that they recommended, and that, lower risk potentially there. But when we're talking about something like scleroderma that has these long-term impacts of not getting to the right treatment as fast as possible, that's really where we have a problem, and where we think that, no, you and your doctor should be the ones to decide what's best. And so we want to be able to tell stories of how people have had to step through and or try and fail products, and how that impacted them, so that the legislators really understand that we need to be able to change the system so that it is more accessible and it's more flexible for the patients that really need to get to the treatments that are going to be the best for their disease, and that can stop them progressing in their disease as quickly as possible. And so that's what step therapy is. There are other ones that go in between there as well. There's things like non-medical switching. There's copay accumulators and maximizers. So things that they put in place that mean that those copay assistance cards that you get from the manufacturers when you do apply for patient assistance, then sometimes they don't count towards your out-of-pocket costs. And so they're just taking money and you're giving more money. And so, we want to make sure that all of those funds that you're getting go towards your actual treatment costs, and go towards the costs that your insurance companies are expecting from you. And so we try to make sure that we're collecting patient stories. We're working with patients to really help them tell those stories so that they can put those and really highlight the impacts of how these different utilization management practices really work in real life for people, and can really help to make sure that we're pushing the envelope and how we change that. And so it's super important, because frankly, if we don't change this, then patients are going to continue to not get what they need in the fastest way possible, and sometimes not in the places that are better for them. Like I said, in either that's home or someplace else, or and being able to get the transportation they need. So that's why we really get involved in advocacy. And so we do that either just directly trying to, talk to legislators about what needs to happen. We also try to work with payers, so insurance companies, that actually to try to help them understand how maybe a specific patient or multiple patients are affected by different policies. So we've gotten involved with, for instance, there is a large health plan in a certain state that they made some changes that we were like, wait a second, that's not good. And so we were able to get an audience with them and bring in some patients and bring in some providers to be able to say, hey, this doesn't work and this is why. And did they change their ways? No, they didn't, as kind of expected, but at least we got patients in front of them. And now we are able to go back to them and say, hey, this is how this is working. You made this change and here's the reality of the change. And here were the unexpected consequences. So they hopefully can use that information moving forward and are seeing us as a resource to be able to help them hopefully create better policies as they move forward as well.
Yeah, I love that you say all of this, because this is where I see our similarities. We have Rare Disease Day on Capitol Hill.
Yep.
We had a lot of our families participate in the Coalition of Skin Diseases also. And we just did a podcast on advocacy, and we interviewed 4 advocates from different states. And
I love it.
it was really beautiful watching them light up talking about what they did.
Yes.
And explaining the empowerment of that advocacy. And here, this is where we all it resonates. And one of them that you talked about was that step therapy. A lot of people don't even realize when your doctor says, you know what, I've got the treatment for you. This is going to be a game changer. And then then you find out the insurance wants you to take this, and this before they'll even consider prescribing it for you or even approving it. And now you're upset because you finally feel like you've got something that's going to help you, and instead you got to go through this. So I love that you guys do this. It's wonderful. And
well, there's ripples for that too. Unfortunately, I'm hearing a lot from providers that they're getting really burned out and are not
they don't
wanting
have the bandwidth to fight the insurance companies or anybody else for that matter. And patients have to learn how to be their own advocates and in some of these cases as a result of it too.
It really absolutely is. There is definitely a huge ripple for this one for step therapy because our providers are getting so demoralized by having to constantly fight with health insurance, and especially in the case of rare disease, when it is something that's off label, they have to fight even harder because it's not even like officially prescribed for you, and so they're going to put even more barriers in place, and so it's definitely it's a huge issue.
Yeah, I think and again, these are the areas that we all can come together in the name of scleroderma, but just in the name of rare disease, and that there's an organization like you out there. So we are grateful. And I just wanted to speak on what some of these initiatives are. So it's the step therapy we talked about, copay accumulator and maximizers, health disparities, non-medical switching, pharmacy benefit managers, prescription drug affordability, and they all, and on your website, you speak on each of those initiatives. So it could be something that speaks to, a patient, and across the board, whether it's scleroderma or something else, everybody fits these categories of and so not only do you educate, but you empower the patients to be a part of that. That brings me to Alejandra. I think you wanted to ask her about this, so I'm going to ask you to speak on this.
Yes. What is your toast and gala about?
Well, I was going to say that's a bit of a left turn. However, it does help fund our advocacy efforts. So I'm definitely happy to talk about that. But I'm guessing what I'd love to talk about first, though, is our Champions Weekend, because I think that might fall into it first.
I think that when we were doing the questions, we got things a little bit mixed up. So I'm sorry
about
that.
No, I mean, Toast is definitely everything rolls together in our organization.
We'll roll into that next. But I think it segues into your what is your Champions Weekend? Yeah.
Our Champions Weekend is our patient retreat program that we do every year. And this is where we invite people that are part of the rare disease community or the chronic illness community to apply to join us. And we bring people together in Austin, and when it's nice and not hot in Austin, I promise. And we teach them about these advocacy skills. So we go really in depth in all these different topics that we talked about. And we talk about how do you get involved? How are you going to go tell your story as it relates to this? Part of that is also doing some storytelling training. So we walk through how are you doing a really effective advocacy pitch to a legislator or to the media or in these different scenarios, so that you really feel prepared for how am I giving a lifetime of 25 years of disease, how am I making that a 2-minute speech? It's not easy. So we help you try to figure that out. Also, while everybody's there, we professionally record their story. So if you go to our website and go to our patient stories part, or you go to our YouTube channel, you'll see what comes out of these patient retreats that we do, because we want to have people tell their story of really talking about being diagnosed with this disease and how trying to find the right treatment has been so potentially difficult for them, or what they've gone through to get to it, but also how it was so impactful once they got there. What was it like to finally get to a treatment that really worked for you? It might have been an infusion, or it might have been the infusion got you to the next place that, was the right treatment that got you there. We're not saying that infusion or injection is best, but it's part of the journey for so many people. And so how did you kind of get to the place you are now, where you're really living your best life possible? That being said, if you're not living your best life possible, you still can apply for this, because we still want to hear your story. And so, but really how finding a treatment that worked and getting there has been really effective for you and really helping you build your life. So we do that once a year. We'd love to be able to expand it. At the moment, it's just that once a year program, but it is a huge part of our advocacy efforts, because those champions then become the people that talk on patient panels or have speaking opportunities. Or we had one of our recent champions just spoke at a CMS roundtable, so Center for Medicaid Services roundtable, about her experience with the healthcare community. So these become the people that become our voice and the voice of other people living with these chronic and rare conditions out in the world. And so that's a really beautiful thing that we do. We are going to be expanding this year into an advocacy academy as well. So that's going to be a little more accessible, especially for folks that maybe are all the way in Hawaii. But this is going to be a virtual training program that's going to, again, go into really in-depth, probably like a 6-week course. We're still building it, where you're going to get really, really, really familiar with all these terms and all the laws that go along with it, and the legislation that gets part of it, and the storytelling you can do around it, so that you really feel like you can go and build an advocacy program with your support group, or you can become a really effective advocate yourself and really kind of help maybe guide other people as well. And also be working with us, because these are, again, going to become part of that advocate group we have. So I might be calling up Alejandra and saying, hey, there's something happening in your state. Can you help us figure out how we do that? Can you talk to your support group about what's going on? Can you go and testify to a legislature, things like that? And so those become kind of our sort of extension out in all the different states, to make sure that we have voices that we know are trained in what to say and how to really advocate for the needs of our communities. I'm excited. It's going to be great.
Do you fund this for the patients?
Yes. Yeah. So our Champions Weekend program, we want it to be accessible to everybody. And we recognize that means, and frankly, living with a chronic illness is expensive. It's really expensive. And so our Champions Weekend program is entirely funded. We pay for the travel, we pay for airfare, hotel, and most of the food while you're there. We also do have what we refer to as a scholarship program. So if, eating at the airport is not cheap either. And so if that is a barrier, we want to make sure we're going to, help you with that as well. And so we really want it so that people of all walks of life can come and join us. So not just people that can afford to travel, because that's not easy. Yeah. At the moment, we haven't had anybody try to come from Hawaii or Alaska yet, because frankly, it's also just a weekend. And so at the moment, it's just a weekend. So that's an awful long way to travel for just 2 days. And so it might be that if you're too far away from us, we might say, let's figure out how we work together in a different way, which is where one of the other reasons why we built the Advocacy Academy is that it makes it much more accessible to people that are way, way, way far away from us, all the way in the far reaches of Alaska, where you can still be doing this.
I love that. I love that you have the opportunity in both ways. And again, we have patient risings that we work with. Every Life Foundation. You have the Coalition of Skin Disease, and so there's all these areas that we can come together. We have likeness in all of them, and these are different opportunities that we can continue to advocate. And one of our advocates had scleroderma, but she also had I think it is hidradenitis. Can't think of it. It's a skin.
HS, hidradenitis suppurativa. Yeah, that's a hard one to say, isn't it?
So as a result, she advocated for both while she was there. Yeah. And so while we are focusing on specific things, she said this resonates with me because this is something I deal with also. So we really appreciate that. And again, getting the word out that you don't have to just stick with this one little, area. We should all be expanding, in the best interest of the families that we serve. And so
absolutely. Our intention with Champions Weekend and with our Advocacy Academy is that your information doesn't stay with us. We want people to take the information they learn from us and take it out into the community, share it with people. The more of advocates we have, the better. It doesn't mean that just because you did our Champions Weekend or you've signed up for our Advocacy Academy that we don't want you to go to,
Of course.
the really amazing
Of course.
Every Life Foundation does a fantastic Hill Day. Go do it. We want that. We want you to use your skills, to really make sure that we're pushing the more the better. Again, the more voices that we have out there, the more stories we have telling telling the stories of what you need, the more effective we're going to be, the more we're going to change.
Right, because some of these things are limited to the amount of people. So if this organization doesn't have any availability, this one does. And again, then we all come together, and then you see everybody like on Rare Disease Day, and hey, even the different organizations. But that's what this is all about partnerships and collaborations, because to be that voice and to watch some of these advocates bloom into who they're becoming, like this young adult that I was like a proud mama watching her talk about her advocacy endeavors and where she's going with this, and the example that she is setting for others that haven't gotten there yet, but see through her that they can be empowered also. So I love that, we make sure that everybody knows that you're another great organization that affords the opportunity to do that.
Yep.
Thank you. So we'll go back now to talking about your Toast Gala, because you're a nonprofit at the end of the day, and you need fundraising as well.
Yes, yeah. As much as I would love to say I'm independently wealthy and fund this entirely on my own, and that is not the case for sure. I'm still a social worker at the end of the day, but yeah, our Toast Gala was born this is our 4th year doing it. And, it was really because we want to make sure we're diversifying where we're bringing in money. And also, depending on the sources where we get our money, we are sometimes limited in what we can do. So for instance, we do partner with pharmaceutical companies, and they are not able to do certain things, like they're not able to pay for patient travel, for instance. And so when we're talking about bringing people to Austin or taking people to Washington, D.C. to do our Hill Day, that's money that we have to fund. And so we have to find that. And so this is where it's great to have a partner like the National Infusion Center Association. They do an annual conference. Again, I mentioned that earlier. And so we take advantage of the fact that we have this huge community of people that are also involved in infusion in the same place at the same time. And so we decided, what better way to do some fundraising than to bring those people in that actually have some, a stake in the game, and be able to have a great dinner and a program with them to be able to really highlight the work that we've done, and remind them of how we can partner with them, and to really and then put some patient stories forward in front of them to say, see, this is what we've done, these are the patients we're working with, this is your community too. And so really make sure we're highlighting those. And so that came about, and frankly the name came about because I just happen to love champagne. So I know that's kind of a terrible thing to say, but yeah, it's just, I was like, let's toast to the work we did. And frankly, if I can have a champagne wall, I'm going to do it. So we have a fantastic champagne wall that comes out every year. And it's just a really fun way for us to help, start out their conference. So we do it the day before the conference starts. This conference starts at 8 a.m. You got to come early anyway. So come have dinner with us, and then also, help hear about the work that we're doing, and have fun doing it, but also help us raise some money that really helps us make sure that we're keeping our programs accessible to everybody. Because again, it's really, really important to us that this is accessible. Again, we talk about health disparities. We talk about, trying to make sure we're representing everybody. We can do that because of the money that we're able to fundraise. We're able to provide the transportation and the housing and the things that, we're not able to get in other ways, to be able to make this accessible for everybody, and that we can really, bring the people that we know have really, really powerful stories to the places we need them to be, to really help us kind of move the needle on this healthcare policy business.
I love that, because I don't think people think about that. At the end of the day, it's just like us. We have fundraisers. We have our smaller, like we're having a walk coming up on June 27th, and Alejandra is one of the co-chairs of it. But we also have our gala. But we have to remind people that we need people to support the organization that supports them, and that the things that we're able to do to provide resources, support, outreach, education, it doesn't come for free. And so we need to be able to, have financial support. And so if people see the need and how important this is, then, hopefully they'll jump aboard. And I like that you have the two things together, that you have the gala, which is such a nice event that brings such a beauty to something that's brought a lot of chaos to people's lives. And then you have the education that comes afterwards. So is it it's patient centered, the
The program is,
conference,
yeah.
right?
No, the conference is specifically associated with infusion center operations.
Got
And
it.
so it is a lot of people that own and operate infusion centers and kind of the ecosystem around them. So the things like, the vein finder companies and the companies that do the chairs and the tubing and the pumps and the all of that sort of stuff is all part of it. So all of those pieces, all, kind of, again, they wouldn't have businesses if they didn't have patients to serve. And
Absolutely.
so we are there to remind them that, these are the patients that you're served. This is why this is important. The work that you're doing is important, and this is why, and so come be part of our mission. We want to make sure that we're helping, make sure that our patients are getting what they need from you as well. Having better pumps, having better, materials used in the bags and the tubes that are healthier for people and better for the environment is a good thing. Making sure that there's medications accessible because there are rare diseases that don't have great treatment options, things like that. That's part of what all kind of happens at this conference. And so it's a quirky thing to do, to be honest, but it's kind of what we need as an organization because unlike Scleroderma Foundation, people don't naturally come to us because they're going to say, I have scleroderma, so I'm going to go to the Scleroderma Foundation. And so our community kind of becomes the nonprofits what we work with and the patients that are part of those, but also this kind of bigger community that surrounds just this treatment type. And, and that's kind of how we have to operate. So it's a little bit weirder, but frankly, I found that these people are fantastic. They are really dedicated to patients. And also they love a theme and they love a party. And so I'm able to really kind of fulfill all sorts of niches for them. And so hence how Toast was born is that, frankly, I got to know them and they all like a party and a theme. So we're gonna Disco Inferno this year, and it's gonna be a really good time. I'm excited for it.
Disco Inferno, I love
Yeah.
it. And you said something that thought made me think of a memory. When I worked at UCLA, we were at the research office, and the pumps were so antiquated in the 90s and the early 2000s. And then when I left UCLA and I was in another department and I wasn't around that as often, I didn't see the changes. And going to visit patients in the hospital and seeing the innovative pumps and the things that they're using now is far beyond what I remember from the 90s and the early 2000s. And so you saying that just brought a memory back for me. And maybe, we like to talk about research and the evolution of where we used to be back then and where we are today. I think it would even patients that had the more antiquated system and where they are today would be something that the infusion centers might appreciate knowing, because some of them never had to deal with that, or these patients that have been around chronic illness for a very long time. So I just thought I'd throw that in there really quick.
Yeah.
You said that.
And it's been fun because it's not just the medication, it's the entire ecosystem around it. For instance, insurance companies still require them to fax things like fax. Who does fax anymore? Only the health insurance companies require fax, right? And so, just the businesses that have kind of blossomed within this, in this space to be able to try to get patients to a medication faster, like the AI technology that's now coming up to help with, faster appeals and things like that, or the companies that are making faxes more automated, and, the technology that helps with, making sure that the infusion centers know that what inventory they have and when they should, buy more inventory, because of course you can't have medication sit on shelves for too long and things in refrigerators in their case, refrigerator shelves for too long. So it's so fascinating, just the entire, like I said, there's a whole ecosystem that surrounds this one little thing. And, and I came from a place where it was very much like disease, medication, and you kind of don't think about the things in between. And so this has been fun to see this side of it because there's just so much that goes into it, but.
No, great.
I'm getting nerdy on you. I'm sorry.
No, I like it. These are the things that people want to hear. This is what helps them understand. So I appreciate it. And you know this like the back of your hand. So this was easy to ask you these questions, and you fulfilled exactly what I've been hoping that I would get out of this. So much appreciated. Alejandra, anything else?
Yes, so we are almost coming to our end of our podcast, but we always like to finish with a fun fact. Can you tell us a fun fact about yourself?
Oh gosh, I have so many weird ones. Let's see. I played rugby in college. I have 2 Boston Terriers, and I'm very afraid of clowns. There's 3 for you.
You and Jerry Seinfeld.
They're just, I was born, at the wrong time. The movie It came out when I was just at that pivotal age, and it scared the bejesus out of me. And so I just, Yeah, there was a recently like a street fair that happened in my like two roads up here and then main road, and there was clowns, and I just was like, don't run away, don't run away, don't run
That
away.
is so funny.
It's
That
so
is so
dumb.
funny. No, it's not. I love it. I love it. We all have them. That's why we ask. There might
Yeah.
be somebody listening going, I don't like clowns either.
I mean, it's the makeup. It's the makeup. So, but yeah, thank you for asking. It's a random one.
So, is there anything else before we finish that you would like our audience to know?
Last thing I will ask is we have a newsletter that sends out where we just do general information, highlight patient stories, and then we also do a second one in the month that is for advocacy specific. And so I would invite you to visit our website, sign up for a newsletter. I promise it's worth it. We try not to spam you, but it's a really easy way, especially our advocacy one is a really easy way to start getting involved in advocacy. And, and usually again, those things are really going to overlap nicely with the things that the Scleroderma Foundation is also advocating for. And so it's a good way to get started. And certainly something, if you're part of a support group or you're working with other folks with scleroderma, you can share those resources with folks, you can share those stories, but it's a simple thing to do. And again, we try to keep things really educational, like for instance, the Trump administration came out with Trump RX, which is supposed to be a direct to consumer, sort of place where you can buy medications. We had a whole article about like, what is this? Who knows? And so, because frankly, there's so many things happening, this is a way that we can try to get you some information and we distill it down so that you can help understand it. But so I'd say invite you to go take that. Also, just invite you to, once we get champion applications open, please, we would love to have somebody with scleroderma come and join us as well. So please apply and then just, check out our patient stories. We're really, really proud of the patient stories and the patients that choose to come and share them with us.
Well said. Well said. In our final recording, we will have links to your website,
Great.
and we will talk about those things to make sure that it's easily accessed for our families. We have a
Great.
5 Minute Friday newsletter, and we think it's very important that we try to keep up on latest things that are going on. And it's the same for you. And I appreciate that you said that you don't try to bombard. Sometimes some of the organizations that I sign up for the newsletter, it's just too much. And there are a lot of things that don't resonate, but it sounds like you guys are very focused on very important things. So
we try to keep it digestible.
And our families want to know. This is a big part of their life. So having your newsletter and having things that keep them abreast of what's going on is important. So I'm glad that you brought that up.
Well, and if our regular newsletter doesn't fit the bill for what you want, no big deal. The advocacy newsletter is you can unsubscribe from one and not unsubscribe from the other, and then you're just getting advocacy, which totally get it. I know I get so many newsletters, and so you're not going to hurt my feelings if you try it and you don't like it. That's okay. If there's certain pieces you don't like, you're welcome to tell me about them too, though, because I'm always open for feedback.
Oh, that's
Again,
nice.
we're still young, still growing. We want to make sure we're trying to serve the needs of the community. But yeah, it'd be great. Those are my only two asks, but because I know you guys do amazing work and have fantastic volunteers that work with you. And so
we do. We have wonderful people.
If we can help out a little bit, we'd love to do that.
Yeah, I would love that too. I'm so grateful. We really appreciate your time today, your expertise, your knowledge, and your passion, because you definitely have passion. And I think that you've really helped our families understand what your organization is about, what you do to help the families, and what you do to empower advocates. So from our heart to yours, we just want to say thank you.
Thank you. I really appreciate the time. It's been so fun to talk to you both, and I look forward to more collaboration with you guys.
Thank you.